Caring for a loved one with dementia and Alzheimer's can be overwhelming, emotional, and at times lonely. If you are a family caregiver or professional caregiver navigating the challenges of memory care, dementia, or in-home caregiver, you're in the right place. Welcome to Empowerment Lounge for Caregivers, where each week we share stories and practical tips to help you care for your loved one with more strength, confidence, and compassion. I am your host, Lin White, a CEO of a home care agency, Alzheimer dementia care advocate, and a lifelong caregiver advocate. At Present Care Community, we believe we create hope, healing, and unforgettable bonds. Let's build something beautiful together. Your caregiver journey deserves support, strength, and compassion. Step into a stronger, brighter path for your caregiver journey. Empower your caregiver journey. Take the first step today. And remember, we make memory care and caregiver support stronger, kinder, and better. So let's talk about what it means by earlier onset. So most people think Alzheimer's hit in your 70s, your 80s, but in many Black and Latino families, we sometimes see symptoms as early as late 50s or even early 60s, and sometimes even earlier in some people. But here's the problem. When these symptoms show up, they're often brushed off as normal aging, or the person is told they just stressed out or depressed or so much going on in life, so that's why we probably forget it. But forgetting appointments, losing the thread in a conversation, or misplacing things regularly, those are not just aging. They are red flags, and we need to treat them that way. So why is early onset often missed? One reason is lack of routine screening in communities of color. Yes. Another is limited access to specialists, especially in rural or underserved neighborhoods. And let's be honest, too often, doctors may dismiss or minimize symptoms in Black and Latino patients, assuming, it's just stress, fatigue, or even lack of education. And sometimes family members themselves hesitate to speak up because of stigma or because we don't want to believe something serious could be happening, right? So we don't want to talk about it. But silence delay care, and that delay can rob our loved ones of years of better quality of life. So now let's talk about the diagnosis. According to multiple studies, Black and Latino individuals are significantly less likely to receive a diagnosis of Alzheimer's, even when they have the symptoms. That's right, even when they have the symptoms. So even when we bring it up, even when it's clear something is wrong, this result is a double burden. First, symptoms worsen without intervention. And second, we lose access to vital support like memory care programs, medication options, caregiver training, and even so much more. Diagnosis open doors, but without it, we left struggling in silence. So there's compelling evidence showing that Black and Hispanic older adults are more likely to have missed or delayed Alzheimer's diagnosis compared to their white peers. In 2021, prospective cohort study published in the journal Medical Care examined racial and ethnic differences in the timelessness of receiving a clinical dementia diagnosis among older adults in the U.S. So this study had nearly 4,000 adults ages 70 and older with probable dementia. Even though all participants had signs of cognitive decline, 46% of non-Hispanic Black and 54% of Hispanic individuals experienced a missed or delayed clinical diagnosis, compared with 41% of non-Hispanic white individuals. So on average, the delay in the diagnosis was longer for both Black and Hispanic participants by months to years, meaning the damn disease had progressed further before they were officially diagnosed. So without a proper diagnosis, families are stressed out. Families miss out on any kind of early support, memory care support programs, medication that can help, and family and caregiver training that's extremely important in knowing how to manage people with dementia or Alzheimer's. So here we have it, that in Black communities, we are not getting enough support at all from any of our doctors as far as help with diagnosis with dementia and Alzheimer's.